Can you exercise on your back during pregnancy? Let's debunk this supine myth. Today's episode is one I have been itching to record because it's something I hear again and again in prenatal fitness spaces. And even from patients who are told by their medical providers during a prenatal appointment. Quote, do not exercise on your back during pregnancy after the first trimester. All right. Today, we are breaking down the myth that after a certain point in pregnancy, it is unsafe to exercise on your back, or sometimes you'll even hear that you shouldn't be in a tabletop position, which is essentially hands and knees. Let's chat about where these recommendations came from in the first place, what the latest research actually says, when and why you might need to modify, plus how to do so, and how to confidently coach yourself to self regulate movement in these positions, such that it is best for you and not a blanket statement for all to follow. Because the truth is, blanket roles, such as those stated during a group fitness class, they don't serve you as an individual. The recommendation to not exercise on your back after the first trimester, it's simply untrue for 92% or more of women. All right, let's dive in. So, if we were to Google why you shouldn't exercise on your back in pregnancy, I literally just typed this into Google because I was curious what came up. Here is what it says. And you know how it now does this AI overview. So, this is what pops up when you Google why you shouldn't exercise on your back in pregnancy. You should avoid exercising on your back, especially after the first trimester, because the growing weight of your uterus can compress the vena cava, a large vein that carries blood to your heart, reducing blood flow to you and the fetus. This compression can lead to supine hypotensive syndrome, causing symptoms like dizziness, nausea, and low blood pressure. If you feel these symptoms, you should change your position immediately. Okay, fair. I agree that if we notice these symptoms, we should change position, aka roll on to your left side and change position. What happens? Those symptoms then go away. All right. Now, to say then a blanket statement that you should avoid exercising on your back after the first trimester, that is true for all women is simply not the case. In fact, this supine hypotensive syndrome that they are talking about with the suppression of the blood flow from the vena cava, the large vein that brings blood towards our heart, up towards our heart, only 8% of the population experience this. And the management for it is to simply change positions, or to then, once you know that you are part of the 8% who has this, to then avoid those positions, right? But blood flow compression after about 28 weeks of pregnancy from the uterus growing and pressing on the vena cava is the quote concern here. But again, for most women, this is not even the case. All right. So again, if we go through what pops up when you Google this, they next go on to say, quote, why lying on your back is harmful. 1, blood flow compression. We just talked about that. 2, reduced blood flow to baby. Now, you as the mom, you're going to notice symptoms first. So you're going to know that you should change positions. But yes, if we were to stay there, we would see then reduced blood flow to baby. You will see these maternal symptoms such as dizziness, nausea, sweating, faster heart rate. You'll notice a drop in your blood pressure, especially if you already have low blood pressure. And so then it goes on to say what to do instead. Well, modify exercises, change positions, roll onto your side, and then it gives some like alternative exercises, such as exercising with a pelvic floor physical therapist, such as myself, to understand, quote, safe positions. Now, what's funny with that is as a pelvic floor physical therapist, I use exercises on the back with 90% of my patients. So again, there's 8 to 10% of people who this isn't appropriate for, who will need to recognize symptoms in their body that tell them exercising on their back doesn't feel good after the first trimester. That might be because supine hypotensive syndrome, but more commonly it might be because of pressure in your low back or heartburn. There can be other reasons, right? And so yes, there are modifications, which we will cover today, but we are also going to debunk this myth that you can't exercise on your back or that you shouldn't. And so let's now dive into the history of the quote, no supine after first trimester rule. And if you're not sure what supine simply means lying on your back. It's the medical term for that. Now, you've probably heard this before, especially if you've gone to a Pilates class or a group fitness class while pregnant. Avoid lying on your back after 20 weeks. And in fact, I have personally been to classes who they say, if you are pregnant, do not do any of the exercises on your back. And as a physical therapist with a large belly at this point, I proceed to lay on my back and do all of the exercises with them because I know that I can and I feel good doing it. So these blanket statements, I'm going to help teach you what is true for you and that you can listen to your body even during these group fitness classes, but also like why this even came to be, right? So let's take a step back. This recommendation to not lay on your back after the first trimester of pregnancy when exercising. This originated from sleep studies that showed prolonged supine positioning late in pregnancy, like while sleeping, could contribute to reduced venous return, aka reduced blood flow back towards the heart. A drop in blood pressure, because we're getting less blood return up to the heart, and then potentially this could affect fetal oxygenation, right? So first, mom's going to experience a reduction in blood flow. Mom is going to experience symptoms because of the result in that drop of blood flow, right? And then since baby is getting blood flow from mom, they're saying, okay, then baby could then experience less oxygenation. So this is what we refer to as supine hypotensive syndrome. You're lying on your back, your blood pressure drops, and this is the syndrome that results, okay? Here's the thing though, these findings were based on extended duration. We are talking hours on end, okay? When we use the word extended or prolonged, it's very arbitrary, right? Does that mean minutes? Does that mean hours? In this case, the studies were specifically looking at hours. They were looking at somebody sleeping on her back in pregnancy. And since these studies were done with sleep, we are looking at an individual primarily in a still, resting position, sleeping, not active movement. So if we think of ourselves when we sleep, we're at rest. Our heart rate drops, our blood flow drops. If you think when you're relaxed, when you're going to sleep, your body is at rest. Your heart rate is not up, your blood is not pumping. We compare that to exercise, it is a completely different research experiment, a completely different scenario, right? Let's say you're on your back doing bridges or doing core hook lying heel taps for your deep core. You're doing movement. You're increasing your blood flow. You're increasing your heart rate. The direct opposite of what's happening when you're at rest and sleeping. So we can't take a sleep study and compare that to exercise. They're just not the same thing. So how did we go from sleep guidelines to exercise restrictions? I honestly think it became a liability consideration, particularly in group fitness and educational spaces. Group fitness studios like black and white rules that cover them if something were to happen, as do medical facilities, okay? So that is why you'll hear it from a doctor's office or in a group fitness class because they are covering their bases by saying, well, we said not to exercise on your back after X amount of time in pregnancy, right? They're given a blanket statement. But again, a blanket statement is being resulted from a sleep study and for a syndrome that occurs in only 8% of the population. All right. So we need to look at these things, peel back the layers, and think about what is really the risk here? How many people is this actually going to involve? And then how to recognize it if it is affecting you. And all you have to do is simply change positions so that you keep you and your baby safe. All right. So it really makes no sense in summary as to why the quote, no supine after the first trimester rule got correlated with exercise. This was a sleep study, and yes, we are told not to sleep on our back after the first trimester. This is why, okay? But for exercise, we really should not extrapolate this study to not exercising on your back after the first trimester because when we exercise, we increase blood flow and the chances of supine hypotensive syndrome occurring are much, much less. It is important to know the risk and we will dive into them as well as modifications, but to know this is where it all stems from. And a side note on the sleeping on your back, the same thing is generally true where this affects 8% of the population and your body would likely awake you with these symptoms of nausea, dizziness, sweating, heart palpitations, like you could notice your heart rate is kind of increasing and that would wake you up and make you roll onto your side. So if you roll onto your back when you're sleeping, you really don't need to freak out. If you do so on accident, you find yourself on your back when you wake up, I'll have moms like, worried about it. And it's like, you're likely fine. Just roll onto your side. Your body would likely wake you with symptoms if this were to be an issue. All right, so what do the research and clinical guidelines really say? Let's talk ACOG. This is the American College of Obstetricians and Gynecologists. This is the governing body when it comes to obstetricians, aka OBs, and gynecologists in America, in our country. So their guidelines do mention avoiding prolonged supine positioning in the third trimester. That's again from a sleep standpoint, though. They do not specifically say that short periods of time in supine during movement based exercise is harmful. That's because there's simply no evidence that it is. However, there is still old school mentalities that go to past guidelines and have not updated their educational standards when it comes to group fitness studios or classes, and then OBs even, right? Because I will have patients say that their OB told them the old school thought that you can't exercise on your back, right? All right, here's what we do know. During movement, blood flow is already elevated, which reduces the likelihood of blood pooling or vena cava compression, okay? Because the other concern here is that if the weight of the uterus, if the weight of the baby is suppressing that vena cava and suppressing blood flow, blood is also pooling in your legs because it's not getting back up into circulation into your heart. And so that's why we can see the dizziness, the nausea, the hypotension, the low blood pressure result, okay? And then thus reduced oxygenation to both mom and to baby, okay? But during movement, we're moving our body, we're helping that blood plump through, so there's way less likelihood of this occurring. Now, shorter bouts, like 3 to 10 minutes in an on your back position, in a supine position, do not present a clinical concern for most women, especially if you're asymptomatic. I'll say that again because it's so important. If you are symptom-free, short periods on your back while exercising are not a risk. They're not a pose for concern, all right? Listening to your body is absolutely key. So here's where empowerment comes in on an individual basis. As with so many things in pregnancy, I don't teach women to really avoid movement. I more so teach you what to tune into in terms of monitoring your symptoms and your cues instead. It is so much better from a mindset standpoint to focus on what we can do and what to watch out for versus being told you can't do something or being instilled fear that laying on your back is going to cause reduced blood flow to you and baby. Like, there are so many fear factors when it comes to pregnancy, particularly here in America, that just really rev me up because, again, in this case, it's like, why? The research doesn't back it, right? So if you are lying on your back, if you're in a supine position and you experience nausea, lightheadedness, tingling in your limbs, shortness of breath, or uncomfortable heartburn, then your body is giving you information. That is your cue to change position, whether because of this supine hypotensive syndrome or simply because you have heartburn or you feel uncomfortable, right? You're going to roll onto your left side, ideally, because that is the side that most optimizes blood flow to both you and baby. Or you could come into tall kneeling or a seated position, especially if you're struggling with heartburn, right? That more upright position is going to feel better. So this is especially helpful if you are teaching group fitness or following an online prenatal program. Listen to the signs, not just specific black and white or arbitrary timelines. So I mentioned teaching group fitness, yes, but also, of course, if you're taking group fitness. But for our teachers out there, those who are leading these group fitness classes or our Pilates instructors, I want you to be aware of this to be able to educate your clients. If you feel good laying on your back and doing the exercises with us, that's okay. But if you start to notice nausea, shortness of breath, dizziness, lightheadedness, tingling in your limbs, if you feel like your heart rate just starts increasing all of a sudden, you just don't feel right, roll onto your side, get out of that position, let's modify, right? And that's when modifications will come into play. All right. Same thing is true if you're following an online prenatal program. I do have a holistically well pregnancy program. I think having a certified expert to move through exercises with at home is so beneficial. And in that program, I have a myriad of exercises that are on your back. And I do educate you as you move through. If you're not feeling good in this position, roll onto your side. We can modify with this movement. I also, because of my knowledge and background, do those on your back exercises for shoulder bouts. So we'll, for example, do a round of bridges where maybe we're on the back for 1 minute. And then I will cue you to roll onto your side. We'll do a variation of different side leg lifts. Then we'll roll back onto the back for another exercise, then onto your side. So we'll do multiple on your back exercises, but they're not all in a row so that we're giving your blood that chance to flow through different positions and not have the pressure of baby through the vena cava. So I do it for that reason, of course, with this knowledge of supine hypotensive syndrome, but also because I know women struggle with heartburn, or because pressure through the pelvis or through the back for prolonged duration sometimes doesn't feel the best. So changing positions just in general during pregnancy can often feel good anyways. So how long is too long when it comes to being on your back? Clinically, we see 3 to 5 minutes in a supine position during exercise as a really safe window for most women. And again, that's assuming that you're symptom-free. Should symptoms onset at any point, you simply change positions. That's it. It's that easy. But again, when I'm programming these in, I'm typically looking at like a 1 to 5 minute window. That way we're just staying ahead of the curve versus like an hour of on your back exercise. It's probably not going to feel great for a number of reasons. So tabletop is a position that I've also heard from group fitness instructors that they were told in their certification class to also not have pregnant women exercise in, which again, just really doesn't make sense. It's a different load distribution. There's no pressure of the uterus through the vena cava. And it's overall a really good active position to be in. Tabletop is on your hands and your knees. It's actually a position that I'll modify clients into a lot if they're having trouble on their back. So if you hear to avoid tabletop as well, I would argue back that, in fact, tabletop can be incredibly beneficial for core and pelvic floor activation during pregnancy. It's actually one of my favorites as a pelvic floor and orthopedic physical therapist. It's one of my favorite positions for breath work, bird dogs, modified planks, and so much more. So it's a really great position to modify to from supine. That being said, when should somebody modify? There are situations where I'm more cautious or I'm more knowledgeable that an individual may be more likely for this supine hypotensive syndrome. Again, about 8% of the population struggles with this. We don't need to make black and white statements for everybody to follow standards that really only 8% of the population needs to. But here are some of the risk factors for somebody who may be at risk for supine hypotensive syndrome. And that's why the myth of not exercising on your back came to be in the first place, right? So if you have higher amounts of adipose tissue, particularly through the abdomen, so that would be a larger body mass index, a larger amount of fat cells around the abdomen, that obviously is going to put more weight through the belly whenever you're laying on your back, and thus more weight through that vena cava. So I would be more concerned for that individual being on their back for a prolonged period for more than like a minute or two. I would probably limit that individual to. If somebody has a history of low blood pressure, dizziness, or fainting, that also tells us that they're just more sensitive or symptomatic to changes in pressure, right? This might be your individual that even when not pregnant, if they go from laying down to sitting up and they feel like dizzy and lightheaded right away, it just tells us that they have a harder time returning blood flow from their limbs back up to the heart in general. And so we add in the pressure of baby against that vena cava, their blood flow just may not be strong enough to push up and through and back up to the heart despite some added pressure. So with that individual, I'm also going to be more aware and may fully avoid being on the back, or again, limit it to very short bouts. And then if somebody has current symptoms like the ones I mentioned earlier, if they come in and they're feeling a little dizzy or nauseous or have some tingling, they're already experiencing some of these symptoms that are not because of the supine hypotensive syndrome. Those symptoms just are already present in their pregnancy in general. We may avoid working out on the back just because we don't have any other baseline to go off of, right? If their baseline is already experiencing some of these symptoms. So that might be like an individual in the first trimester of pregnancy where they're just not feeling great overall. They're probably going to just feel better in side laying or tabletop in general versus on their back. Now, for these individuals, I'd be quicker to modify her positions, but it's not out of fear. It's respecting her unique physiology. And again, just listening to the signs her body is giving us versus saying a blanket statement that she simply cannot go in that position. Again, I'm not likely to avoid it completely with really anybody because for very short amounts, it can still be okay, even in these individuals. So, for those in which we are modifying, what does that look like? And when we're modifying, what can we do instead? We may perform core movements in side lying instead of supine. So let's say you're in a workout class and you're doing on your back core heel taps. Well, instead, let's roll onto your side and let's do a side plank. All right. We could use a wedge or an incline under your back for a semi-reclined position versus fully flat on your back. This can be done with pillows or an incline bench at home. And then we can, of course, shorten the duration and monitor your cues more closely, listen to your body more closely. So for instance, you may be good for 1 minute of exercise, but not 10. And so we weave in your programming appropriately for that. And if you're in a group class, you know that about yourself. And so you may say, okay, I'm going to do this one exercise on my back, then I'm going to roll onto my side, do something different there, then rejoin them on my back, roll to the other side, do that side, then rejoin them onto my back. So you can ebb and flow that way. So again, it's not about avoiding supine. It's simply about using it intentionally and knowing when to pivot into a different position. Here's what I want you to take away in summary. So to recap, supine positioning, aka lying on your back during pregnancy, is not inherently dangerous. It's about duration, your individual symptoms, and being aware of your body and your body's cues. ACOG's concern, the American College of Gynecologists' concern, was around prolonged stillness in sleep, not short bursts during exercise. And so with this, blanket statement being translated into group fitness settings, exercise instructors, and even some OBs, to know as the client or as the patient coming in, the actual history behind this can give you so much empowerment and the ability to advocate for yourself. Pilates and other prenatal movement programs may offer very conservative rules because they want to cover their own basis from like a legal standpoint, but that doesn't make those guidelines evidence-based. And it is so important for you to know that. You can choose how you want to move your body independent of those blanket recommendations. And if they tell you you can't in that studio because it's against their rules, then that studio clearly does not know how to optimally support a pregnant woman. And there's other resources for you, my Holistically Well Pregnancy Program being one of them. All right, so, today's goal too was to really teach you to listen to your body and to encourage other women to do so as well. So if you know other mamas in your life who have been told just to fully avoid being on your back during pregnancy, this is a great resource to send them. And then if no symptoms arise, around 3 to 5 minutes in supine or tabletop is generally totally fine and can absolutely be integrated into your workout programs. So most of all, I encourage you not to fear movement. I want you to know how beneficial movement is for your body, and working out during pregnancy when guided by a solid educational backed provider is an awesome way to reduce so many risk factors and create greater ease surrounding your birth and delivery. So there's so many benefits to exercise during pregnancy, including exercises done on your back. So reducing the fear surrounding this myth that you can't lay on your back to exercise during a pregnancy is so important. Now, if you loved this episode and want more myth busting and empowering support through pregnancy and postpartum, check out the Holistically Well Pregnancy Program. It is built with education, movement, and clinical guidance to move through any pain points that come up throughout your pregnancy. You can use code POD20 for a special listener discount. That's POD, P-O-D 20 for 20% off as a thank you for being part of this community. POD 20 for 20% off, and I will put the links below for that. If you're enjoying this show, please take a moment to leave a 5-star review. It helps more women find this kind of empowering information. You can even be entered into our monthly giveaway for a free one-on-one session with me. just screenshot your review and send it over to me on Instagram at Dr. Kayla Borchers. And I will choose one of you for a free one-on-one session at the end of September. So until next time, keep moving, mama. You were made for carrying this baby and this pregnancy.